So how many years as an esthetician?
About 2 years.
And you were in this position that was unique to...
About 1.5 years, I would say.
And what is it you're doing?
Esthetician, so I was doing facials and eyelashes.
Eyelashes, tedious.
Very tedious, 2-hour-long appointments.
Right.
Hunched over, stiff, not able to breathe from staying over for 2 hours, working on clients one after another.
And you couldn't stop in that 2 hours. Once you started, you're in it.
Yeah, right.
Right.
Yeah.
No matter what you felt like, you just pushed.
Yeah.
All right. So what is it you're feeling?
So
feeling?
after like an hour in, I would just feel like I was like cut off of air and like compressed, and I just felt like I couldn't get like a deep breath in.
All right. And you've felt this way for?
Over 1 year.
Right. And you've sought different doctors doing different things?
Osteopaths, craniosacral therapists, massage, other chiropractors that did manual adjustments, many people.
Okay. All right. So I guess we'll just show the image of what we found. So, and you feel like you're always having to swallow, and you end up swallowing air?
Yeah, I feel like I constantly need to swallow, and then I feel like my stomach fills up with air, so then I deal with a lot of burping, just pressure, and then I feel like I'm full all the time, or no appetite because I'm obviously filled with air.
Right. So this is air. There's your lungs. This is your stomach filled with air. And then this is as the air goes through the diverticula of the large intestine and as it moves through. So yes, you have air, but it seems like it's mostly from gulping. Now, in the physical exam today, we found when you let all your air out, it seems like you go into a hiatal hernia. So we had to adjust the hiatal hernia, bring that down, and it seems like you also had a Morgagni hernia going on in there. That is where some of the other intestinal abdominal contents push up through the hiatus of the diaphragm. And we brought all that down and got that diaphragm to no longer be so rigid, and that's why you're able to breathe easier, and you felt a lot of the autonomic vagal type symptoms change once we got that to release. So here's the rest of the story here. Okay. So we have injuries, gymnastics as a kid, blows to the head, and here's what I think we're tripping over the most. And let me bring this up right here. Okay, so this is normal anatomy here. This is the posterior atlanto-occipital membrane, and this is a connective tissue that gets injured. So it looks like yours got injured in through here and calcified from one of your many injuries growing up. And then when we move that, so here you can see that you have this calcification, arcuate foramen over here going around the vertebral artery. Now, what you'll notice pretty much is that the atlas is up to the left, and it doesn't take that, it's not that hard to realize that when you bring your head back and doing that esthetician job for prolonged hours, when you bring your head back like this, it pushes the atlas down and up to one side. So you're basically knocking your atlas to the left when you bring your head back. So we put that in place today. You felt the left side of your head get lighter. And one of the symptoms that make you swallow, gulp air, is that there's some sort of a compression in here that you've been feeling, as well as down by the diaphragm. And that released today too with the adjustment, with the atlas orthogonal adjustment. So that's nice. We did look at the vertebral arteries here, and we did a pulse wave Doppler before and after, and we did see a big difference after the adjustment. But really the thing is that this extra calcification is something that you have to be careful of when you bring your head back. That'll knock your atlas out. So we want you to avoid bringing your head back for 6 weeks. That's how long it takes for the ligaments to kind of tighten up. And there's a rule: if you hold the adjustment for 6 weeks, you own it. It becomes really stable. And that was the big thing. I mean, we had you turn your head to the left, and we do see that it really does swing way up in there. And again, our current working diagnosis is all those positions you're in, as the type of esthetician that you were, you ended up loosening the ligaments and spraining where the head meets the neck. So that's why it kind of really does go pretty far up there. And then when you turn your head the other way, let's clean that up. You can see this, how it even still seems to bind in there a little bit, even though the atlas is going up to the left. Any questions? Anything you want me to comment on?
I don't think so.
There was one other little issue that it looks like the omohyoids might be in play down through here, because we did a ultrasound there and found that your velocities were pretty high. They were about 120 centimeters per second on both sides. So we do, actually this is not the venous phase, but the venous phase showed some muscles in there, some fascia or something that might be constricting. So we want to do some work on that. Okay.